The following medical emergencies video presentation will go over shock by Rachel Collett, group number 1 with Erica and Jung. Shock occurs when the cardiovascular pulmonary system fails and the blood cannot supply the tissues with the amount of oxygen needed. This leads to the abnormal cell and tissue formation. There are 4 stages. The first stage is the initial stage, which is when the cells are first deprived of oxygen. The compensatory stage is when the body will perform physiological adaptations to overcome shock. The progressive stage happens when the compensatory mechanism fails and the body's organs become compromised. The refractory stage is when you have organ failure, cell death, and brain damage. There are 4 types of shock. There's hypovolemic shock, which is the most common form, and it is caused by hemorrhaging or dehydration. There is also cardiogenic shock, which is a decreased cardiac output, myocardial infarction, arrhythmias, and cardiac dysfunction. There's also obstructive shock, which is indirect heart pump failure, arterial stenosis, pulmonary embolism, and cardiac tamponade. And finally, distributive shock, which is septic, neurogenic, or anaphylactic. The signs and symptoms of hypovolemic shock are dehydration, rapid and 30 pulse, cold skin, reduced urine output, and mental confusion. The signs and symptoms of cardiogenic shock are reduced blood pressure, fast pulse, clammy skin, cyanosis, chest pain, shortness of breath, reduced urine output, and mental confusion. The signs and symptoms of distributive shock are hypotension, respiratory arrest, fear, edema, anxiety, restlessness, thirst, and bradycardia. And finally, the signs and symptoms of obstructive shock are severe hypotension and dyspnea. When treating shock, the first thing to do is to recognize the signs and symptoms and determine which type of shock it is. The second thing to do is evaluate the level of consciousness of the patient. Then you will position the patient supinely, activate the CABs of CPR, and contact EMS.